So anytime that you're going to do any kind of massage work, if you're doing any fascial release or connective tissue release work, you want to do that first before you get lotion or oil on your client. We're going to start this arm work by releasing some fascia around the wrist flexors. So make yourself comfortable. Not every client can have their arm down and not have the shoulder pop up, right? We want the shoulder to be comfortable. So you always want to be checking the shoulder when you're working the arms or hands with your client so that you're not kind of overdoing it and they're over rotating here. So I like to sit next to my client for this part and then bring their hand over onto my leg because she's going to be opening her arm back like that as I'm doing the fascial stripping. So we start by curling the fist and flexing the wrist, and that's going to make all of those wrist flexors kind of activate. And then I'm going to make sure that her elbow isn't hyperextending. I'm going to lay a hand here on the biceps, and then I'm going to use my knuckles to strip along those wrist flexors, and she's going to start to open her hand and bend her hand back. How's that feel? Good. Feels good, right? Curl back in, knuckles, sink your body, go ahead. And I'm just gliding up. I'm separating those tendons as I'm gliding up those wrist flexors. We're going to do it again. And you'll start to see a little red come out as the circulation improves to this area and the fascia begins to separate. Great. We're going to do that one more time. Curl up, sink, and glide. Great. Okay. Now I'm going to face her a little bit more. And one way that I can work with this elbow is to lower the table, and then her elbow will bend more. And then I'm just going to start some cross glides, further separating those muscles and tendons. Yep. Great. Feels okay?
Feels great.
Great. And then I like to give some squeezes, kind of pumping the tissue, moving that circulation through. And I'm squeezing from underneath along those wrist extensors as I'm also compressing the wrist flexors. Now, another way that we can do this is ask our client to slide over to the left, if you're working on the right arm. I always like to tuck the breast in to make sure that it stays covered. Let me see. I'm going to adjust this a little bit here. So I take the sheet, make it taut against the chest, and then tuck it down and under. So see how nicely that tucks the breast in so we don't have to worry about it. And then we can do it this way where we bring her arm off the table so that she has the room to extend that wrist. Then I can take both hands, go ahead, curl up. Yep, there you go, and glide. Feel that it's more pressure. Curling in, yep. Go ahead and glide and slowly open, spread the fingers. There we go. Great. So that's a little kind of wrist flexor fascial release. So many people when we use our hands like this, those wrist flexors get really kind of sticky together. So we just want to keep warming that up. Okay, great. Now I'm going to use a little bit of oil. And I want to glide all the way up to the shoulder. And you can do this sitting or standing, doesn't matter. to be mindful when you're going through that inner arm that you don't dig real deep. It's real thin here. The ulnar nerve passes in here through the medial arm. So you want to just be mindful to not overdo your pressure in the inside of the arm. And you can lay their arm on your legs like that and squeeze across. Biceps, not down here in that medial arm, but biceps. A little rolling. Great. And then we can work in those wrist extensors. And again, I want to make sure that I'm not forcing. You can see when I push her wrist down, her shoulder rotates forward. For some of your clients, that's going to be really uncomfortable. So I'm going to get a couple more of these towels to just support that wrist a little bit so it doesn't affect the shoulder. So you can just take a couple of hand towels, fold them up, support here where the hand is kind of hanging off a little bit. And you can choose how high you want that to be by how many towels you stack underneath. Then you can anchor the wrist and glide down those extensors. Does that feel okay on the shoulder? Yeah. Does it feel a little better on the shoulder? Have it like that? Yes. And then I'm just using a soft fist, focusing on these knuckles, gliding up. If you want more pressure, you can stand. Or if your table doesn't move up and down and you can't sit, then you can just stand. So now we're going to do kind of that same thing. This time you're going to start in flexion like that. And then you're going to curl your hand down and bring the fingers together. Okay, go ahead. Feels okay? Go ahead, start in flexion, curled, or extension, curl down. There you go. One more time, start in extension, glide, and curl down. Great. Just some knuckle scrubs through here. Bring it up into the biceps and triceps and brachialis. Now, a lot of the trigger points, most of the trigger points in the wrist extensors are within the first couple of inches down or distal from the elbow. And then same thing with the wrist flexors, within 2-3 inches distal to the elbow. You'll notice it's a little chunky. I'm just doing these little thumb glides. It's okay, pressure? A little much? Okay, so I'm going to back off. When I'm standing, I can have so much more pressure. So I want to be mindful of that. I'm always asking. I like this technique a lot. I place my straight fingers and then put my other fingers on top of them or my palm and glide down. I'm going all the way up. Separating with the heels of the hands. Okay. So now we've got things warmed up a bit. We have increased the circulation to this area. I'm always wanting to make sure I'm not shoving her shoulder up, so I could kind of stabilize her arm down as I glide up the biceps a little bit. I can give a little pull to the shoulder, just got a crack in the wrist. Okay, great. Just spreading across the hand. Now I said that the wrist extensors and flexors have all their trigger points right in this area. So I might just do a little extra thumb glides through here. And if I find a part that's kind of particularly chunky, I'm going to go side to side on those tendons, and I might find, here's a little spot right in here. Yep, she said yep. And I'm just going to hold down there for a little bit. You can wiggle your fingers Feel how that activates that a little bit. And let me know when that feels better or easier. Getting better? Okay, great. You can relax. And this isn't a whole trigger point demonstration, but just that you can find like really tender spots in this area. Search around and find a little spot and spend a little time. And I'm just going to kind of milk this area. Now we have the brachioradialis here. It goes from the brachial to the radial section of the arm. So you can actually keep that arm a little bent. This muscle bends this elbow. You're going to let me have that arm. And you can feel the edges of it, and it just kind of pops off like that. So I'm going to take a little squeeze, take a little squeeze, little squeeze. Relax that arm down. You can always say less at any time if you want less pressure, if I'm doing a little too much. Okay. I'm just gliding along, gliding along. And then I can cross my thumbs and sink in. It's okay? And sink in. And I'm kind of tractioning the skin up toward the elbow a little bit when I do this. Great. Scrubbing. Okay. So now the wrist flexors live here. And we're going to do some of that same stuff. We're going to scrub. I'm going to sit down, put her back over here, lower this table. And I'm going to lower it more so that her elbow doesn't hyperextend. So if you have the table that goes up and down, you can sit and then support her arm here, or you can adjust your adjustable height chair and do some long stripping. And I want to make sure I cover the whole thing. I want to go all the way to this back edge of the ulna. And so in that way, I know I'm getting all of those wrist flexors. And I can, every stroke is palpation. Every stroke, I'm going, oh, where is it sticky? Where's the fascia sticky or the muscle sticky? Where do I feel a little grain of rice, which is kind of what a trigger point feels like this spot right here. Yeah. And just going to sink into that and hold. Take a nice deep breath. Exhale heavy. Sink your body into the table. That feels a little better, yeah? Great. So some other ways that we can protect our body and our hands is to glide with the ulna down the arm. Again, you can do this standing. You just can support the arm. But I find sitting is a great way to do this work. Feels okay? Great. And then at the wrist, I want to just do some little thumb circles. Okay. So I want to take the wrist and kind of traction it as I glide my thumbs down on those tendons. It's okay? Not too much?
Oh, feels good.
Great. Because there's so many tendons that pass through this area, they can get a little sticky together. So we're just kind of separating those tendons a bit with the thumbs, little thumb glides. And then circling around that wrist bone, the malleolus here. And then circling around the malleolus here. Right at the base of the thumb. Great. And now we're going to do some hand massage work. And I'm going to use cream. I always use cream or lotion for the hand. Okay. So just apply some cream. So nice. Thumbing the palm, and then just on the above the wrist toward the fingers here, so distal to that wrist crease, right in this area between the thumb and the pinky side is the carpal tunnel. So it's a little roof. It's called the flexor retinaculum, and we're gonna do some cross stuff, some up and down. That's the technical term, cross stuff. And then we're going to thumb circle over that carpal tunnel. Just kind of freeing up that fascial band across there. Right. And then for the hand work, just gliding on the thumb and really getting into that meat of the thumb. And then into that webbing of the thumb. And then I like to kind of push into the edge of that phalange right there, of that base of the thumb along there. Is that okay? Mm-hmm. So I'm literally pushing the tissue up to the bone. And I can do that the other way also. Just pushing that toward the bone. And then soothe. You can relax your hand. And you just keep reminding your clients to relax. It's okay. And so we're going to circle around the joints and all the way up to the thumb pad, and do some pulls on the thumb. Okay. And I'm going to turn her hand over. So notice, right, I don't want to try to force her arm to go where I want it to go. I want to adjust myself so that I'm following what my client's shoulder and elbow are capable of. So we do some of those across squeezes, across the hand, at the wrist, little circles with the thumbs, finding those bony prominences of the malleoli and circling around them just to kind of free up the fascia and the connective tissue there a little bit. Nice long drags all the way out the fingers. And then the thumb. Now we're on this side of the webbing and we're just going to kind of massage that. Slide your thumb and grip with the finger like this. Slide and out. Slide and out. And I'm squeezing these together. Slide and out. And then I'm going to sink my thumb in and press into the edge of that bone. You might find it's a little bit tender as I go up here. Is that true, Stacy? A little tender? Mm-hmm. There's often a little point right here at the base of the thumb. So I'm just going to hang out there if it's tender. And she said yes. She's going to take a nice deep breath. So there's these little adductor muscles of the thumb in here. They get a little tense from picking things up, grabbing things, eating, all the things that we do with our thumb, right? All back out the top of the thumb, circling around these joints. Don't skip the finger pads and the fingertips, lots of sensory receptors in there. And sliding through these carpal bones and through the phalanges, all kind of tracing in between the bones of the hand with the thumb. And then we're going to go to the pointer finger, circle a little bit around that knuckle. And then I do this little twisty with the fingers, kind of squeezing. And all the way up to the finger pad. And then in between the fingers, in that webbing. Circle around the joint at the knuckle. Circle the knuckle. Circle the knuckle. Squeeze the tip of the finger and then twist. All the way up. Circle. Circle, circle, tip of the finger, and then rotate. Is that okay?
Feels great.
Great. She said it feels great. And then on the pinky, circle the knuckle, circle the knuckle. We're just helping to free up some stickiness around the joints so that they don't get arthritis. Or if they're having arthritis, this will feel really, really good if they have any arthritis in these joints. And then twisting. You can also then just kind of pulling along the thumb, pinky, and then I'm cupping my fingers into the center of the palm and gliding over, separating those carpal bones, giving them a little bit of freedom. And then just doing these nice long glides out the fingers. Yeah, great. Okay. We're going to turn the wrist back over. Nice long glide up through the biceps and back. A little squeeze, pull all the way down to the wrist and onto the palm. And you might have learned this in massage school where you can take your pinky and put it in their pinky and then the other pinky into the pointer finger area so that you can spread open the palm with the fingers, right? So we weave in the pinkies in between the end fingers, and then we can bend the wrist if we need and move back and forth like that. And then we can also massage the palm with the thumbs. And we're just using this position to help keep the hand open so that it doesn't curl up and we have space to work. Make sure you really get up around those joints at the base of the fingers. Okay. So the bones are carpals, metacarpals, and the fingers are the phalanges. Okay. So now I'm going to let her hand hang off the table a little bit. I'm going to put my heels of my hands right at, see that bony nub there on the ulna? I'm going to kind of trap that. Okay, Stacey, you're going to be super relaxed for this part. And then I'm going to go like this. Shake, 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 shake. She's doing great. 5, 4, 3, 2, and 1. And drag. How did that feel? Okay?
Yeah.
Great. It often feels better than it looks. Okay. And so that's our hand massage. Oh, I want to show you one more thing. Another way that you can work with the hand is to bend your knuckles like this and trap the finger in it. And then you can circle around. You can squeeze, squeeze. That's okay. Squeeze, squeeze. or you can just kind of do these little rotations. Not too hard with the squeeze. You don't want to twist their finger off. You just want to kind of glide along that tissue. This is one of my favorite ways to protect my own hands and my thumbs when I'm working in the hands. That feels okay?
It does.
Even after 31 years of doing this work, I'm still always communicating with my clients to make sure that they are enjoying what I'm doing. Okay. So now I'm going to stand up and I'm going to work in these wrist extensors, do a couple of long glides. I'm going to apply some more oil. Notice I'm kind of supporting her hand here so I don't force that elbow straight, because what's going to happen is that shoulder is going to keep coming up, right? So I want to support that. I can use my little towel rolls here, which will make it much more comfortable for her shoulder. And then I'm just going to take my ulna and glide down to the elbow and up on the biceps a little bit. Ulnar glides on the extensors. Pressure okay?
Maybe a little less.
A little less.
Trigger points.
Yeah, so I'm going to back off a little. Once I stand, I've always got more pressure on my client. So again, always good to check and make sure that the pressure is okay. Still good?
Yeah, it's great.
Great. And then I said right here in this section is where the most of the trigger points are in those wrist extensors. So I can just lay my ulna in there and I adjust my body so I have the right posture for myself. And then I can rock the ulna forward and back. You let me know about pressure.
It's good.
It's okay. A little bit tender in there?
Yeah.
Yeah, tender. So I can always back up a little bit by raising the table if it goes up and down, or just dropping myself lower so that I don't have as much body weight over the arm. So again, my ulna lays across those lines where the trigger points are, and then I just rock it forward and back, okay?
Mm-hmm.
Notice I rock my whole body and not just my arm. I don't want to just do it with the arm. I want the arm kind of along for the ride. I can slide down a little. That's going to be tender if I push in there, isn't it? Yeah. So when I find a tender spot, I can just hold right there, right? I can just hold. You can wiggle your fingers, flex and extend the wrist, lift it up and then down. Feel how that moves it underneath my hand? So I had her extend and flex the wrist a little bit, so she's kind of wiggling that in there. Notice her range of motion just got so much bigger. That means the trigger point released, or at least started to.
Yeah, I could feel it.
Change, right? Big change, right? Okay, relax the hand and glide. All right. Then we can move up into the upper arm. And every once in a while, I just want to do this long glide. Even when I work in biceps and shoulder, I want to just come down and do a little glide and pull. I don't want to yank her shoulder. Please don't do that. But just a little pull and a little glide all the way out the fingertips. So I also wanted to show some quick cupping glides because, again, there's just so many tendons and so much fascial tissue. I mean, everywhere, right? But there's so many thin little ropey muscles and tendons through the forearm. And you can do some nice fascial glides. So notice here another thing. When I'm supporting, I can grab, but I don't want to grab, it's gentle. So a gentle grab, or even just placing the hand as a shelf so that their arm and hand is supported. And then you can take any size cup that's going to work depending on the size of your client. And so for this one, I'm going to just squeeze that and put it on there. Feels okay? And then just gliding up and down. Now, if it sticks, just use a little less pull on those tendons. Feels okay?
Mm-hmm.
You can go up into the elbow, right? Now, I could use a smaller one so that I can get all the way to the wrist and down, to the wrist and down. And you can see that her forearm is really red now. And that's just, I've just increased circulation. I'm not trying to break blood vessels. I don't want those big cupping hickeys on her arm. That is not my goal and intention. I'm trying to free up the fascia gently so that the circulation is improved, nervous system communication is improved, and the fascia and the muscles feel free. Here I do this little twisting. Feels okay?
Mm-hmm.
Should feel really good, actually. She's like, I'm not going to say that.
The twisting feels good.
The twisting feels good. The gliding, not as much. Okay. So we're going to take it to the back of the arm. Gentler glide. I'll do a gentler glide. Okay, good. She said that feels good. We're going to go with that. If it's too hard and too much and they're not relaxing, just release some of the pressure. Take the cup off, squeeze less, and then go up and down. Really helpful to do some cupping around the joints and freeing up around those tendons and ligaments. Okay, great. That's a little bonus. Okay. See that beautiful pink color now in her skin? We've increased circulation, but we're not leaving those hickeys. When you leave those little cupping hickeys, there's actually broken blood vessels in there. That is not my goal. Now I'm noticing that my friend Stacy here has this scar, and we talked about it a little bit. I'm going to just put a little cup right there because scar tissue is super sticky. I can spin it, and I'm just going to give her a little bit of freedom right there. Is that okay? So the upper arm, we've got the biceps, and we have brachialis, and we have triceps. That's mostly it. There's not much else going on there. A little anconeus over by the elbow. You got some coracobrachialis deep in here. I'm not going to work deep in that inner arm because it gets real nervy. Unless they're really having problems there, I don't spend a lot of time there in general. Nice glides. Then I'm going to start just kind of separating the biceps. It gets real chunky right up here. You can kind of even see, maybe I'm like clunk, 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 clunk. So what is this? This is the bicipital groove. And the pecs, lats, and teres major from the back and the pecs from the front kind of attach in here. You don't want to dig in this chunky area. It's always chunky on everyone. And she would get really mad at me if I started really digging my fingers in there. Is that true?
Yeah.
Yep, that's true. Yep. I'm just going to glide that. Okay. So what I can do is bend that elbow a little bit. Find that chunky thickness where those muscles attach. And I'm just going to sink in, not real pressure, not a lot of pressure. And I'm going to rotate her arm in and out like that, internal and external rotation. I can glide up a little bit. I'm just a flat thumb. I could place a soft fist there and cover more territory. Is that pressure feeling okay? Mm-hmm. And you can let me do it if you want. Just saying. Yeah, great. So the biceps bend and supinate the forearm. So we can glide up, bend, and supinate, and that's going to keep those biceps nice and soft. Bend and supinate. Bend the elbow, supinate the wrist. See that I'm kind of doing this part. But then we can go the other way. We can bend and, we can extend and pronate. See how that's a little tighter, a little more tender maybe as I do that? Yeah. And so I'm not, again, not super deep pressure. I don't want to freak out those tendons, but I do want to free up this attachment area. Did it get a little more tender in there? Yeah. I could tell because she started resisting, right? And so that's okay. We just do some soothing. If you ever just go a little too hard for what they can tolerate in the moment, just pause and do some nice, gentler soothing, because you're not just you're regaining the trust of their body. And sometimes you go a little too hard and their body goes, oh, and then you just want to soothe it and go, oh, I'm sorry, it's okay. It's okay. Yeah. Now I'm going to let that shoulder externally rotate a little bit. This is very gentle through here. I don't want to dig my fingers in. Please don't do that. Gentle, soft slides. And up into the shoulder. So now I've done some warming through the biceps. I'm going to do some warming glides along brachialis. Soothing brachialis. Relax the arm. Yeah. Just a reminder, you can always just go less. Okay. So brachialis out here, biceps brachii here, brachioradialis here, all of those muscles bend the elbow. So sometimes I'll kind of place my knee up on the table so that it's nice and soft. That bend is there. I am softening up those tissues. And then I can see if I can palpate that brachioradialis again. And I'm just kind of squeezing in. There it is. And I'm just squeezing those edges. Notice what I do. I can put my thumb along the tissue and kind of push it into my opposite hand. Just doing a little squeeze, brachioradialis. Your right arm is going to feel great. And then for this next part, I'm going to have you actually just keep your hand up here. Again, if I keep trying to force that arm into different positions, the shoulder is going to suffer. So when I'm working the outer upper arm, I'll often have them put their hand up on their body, and then I can place my hand on theirs to stabilize it so that I can glide. Is that a comfortable position? Mm-hmm. And this way, that just rotated that shoulder internally a little bit and gave me access to brachialis. I'm just gliding along. If I don't stabilize the hand, sometimes the shoulder, see how her shoulder pushed it, like she suddenly got less comfortable. Could you feel that?
Yes.
Yep. Mm-hmm. And then we can strip across brachialis. And then while we're there, now we have access to the biceps right here. The biceps tend to hold trigger points down near the elbow joint. So I might do a little bit of like wiggle and squeeze and lift, but I'm going to be mindful to not be a vice, right? I just want to kind of squeeze and wiggle through there. And as I'm doing that, I feel her tissue softening so I can actually get a better and better grab. Wiggling, squeezing, and then I might stay right there. Feel that spot? Yeah, she feels that spot. Yep. You can relax the arm. There we go. And then always just doing a little glide out the fingers. Okay. Biceps. We did biceps tendon under a flat thumb, just kind of freeing along that bicipital groove and the attachments for the pecs, lats, and teres. Gentle glides in the medial arm. Fist glides, soft fist glides on the lateral arm. And then we can get up into the deltoid. I'm going to actually support this way. Does that feel okay? Let me see. Feels all right?
Yes.
Okay. My friend Stacy here has a scar. And so I'm going to do some warming in there, and I'm going to do a little bit of cross fiber. Not real deep because it goes right down into the little valley of the shoulder there. And I might thumb strip along that scar. Feels okay?
Mm-hmm.
And then our deltoid is just this real upper section of the shoulder. So a little cap that lives right there, right? So we can circle. I'm going to use a little more oil. And I'm going to start doing some soothing along the pecs and taking it down the arm there. And then I'm going to slide up into the upper trapezius. And then circling around that deltoid again. We'll do some more work up there with the client face down. A little bit of warming friction. And I just really like to slide a little karate hand up along that ridge, that little valley right there of the shoulder. It's okay?
That feels good.
This is a good thing for you to have this right here. Yeah. And then up in the trapezius. And down through the pecs. And then I follow those pecs down the biceps because the pecs attach into the bicipital groove. Great. Okay. And that's it.